Let's see. People are trickling in. So we'll give it another minute or so before we get started. Unless if someone can verify for me that the okay, the trickling is slowing, so I feel
Jennifer, I clicked just to show the presentation when I share. You will still be visible?
should be. Um, yeah, we should be good on that, Sharon. Yep.
Okay.
All right. What is this? Well, whomever put that in the someone just asked, thank you for providing an ASL interpreter. Good afternoon. I'm Blaze Bryant, the communications specialist for the New York Association on Independent Living, or NYAIL. That's NYAIL. This is part of our webinar series, the third one, as we're already into March. It's hard to believe. You are very welcome. We always provide ASL interpretation and human captioning for each of our webinars. And to access the interpretation, there is a bar down on the bottom of your screen. You click more, and there's the interpretation option, and you can adjust that window however you need. In just a minute, I'm going to put the OneCap app link for anyone who wants to view the captions in their browser. So those are a couple of the accessibility things, as well as we do not have the chat turned on. That is a screen reader accessibility accommodation. So any questions or comments, you can put them in the Q&A box, and we'll save the questions for the end of the presentation. The webinar the webinar is being recorded, and I'll get you the slides and materials. I'm going to do my best to get it to you by the end of this week, but early next week for sure. Okay, why are we here? To hear more about the New York State Respite Caregiving Coalition. And to do that is Sharon Cackett, who is the Associate or Assistant Director for the New York State Respite Care and Resource Coalition. So Sharon, I'm going to mute my mic, turn my video off, and hand things over to you.
Well, thank you, Blaze. Can you hear me okay? I can tell that you can. So really appreciate you inviting me to talk today about the programs and services that are available statewide through the New York State Caregiving and Respite Coalition. So I am Sharon Cackett. I'm the Associate Director of the Coalition. And I know, we all know at the Coalition that the work you do results in individuals remaining well cared for and in their homes to live full independent lives. And we share that mission with the focus on making sure that the families and friends or the informal caregivers who might be part of their care also get the support that they need. I began my work with the Coalition almost 10 years ago after working in a comfort home, hospice home, and as a case manager for caregivers of someone with dementia at a local office for the aging. And I also cared for my mother, who lived with vascular dementia for over 5 years in our home. for all of us on the NYSCRC team, our work is personal as well as professional. So today I want to share with you some advocacy work that we're involved in about family and informal caregivers and their need for respite specifically, the NYSCRC voucher program, and the National Respite Care Provider Training and Registry. So bear with me while I pull up my slides. And if there's anything that needs correcting, please let me know. So our opening slide is two women, one holding behind the other with big smiles, talking about today's webinar. The next slide is hands forming a heart, and it shows the logos of the organizations that fund us. So NYSCRC work is made possible through the support of several funders and partners. Like ILCs, our core functions are supported through the Administration for Community Living at the federal level. The ARCH National Respite Network provides us technical assistance, and the Health Foundation of Western and Central New York supports efforts through grants and through their Exhale program. We work in close partnership with the New York State Office for the Aging and New York Connects, as we are managed by Lifespan of Greater Rochester. Just a little bit of background. This slide has some text talking about the history and where we are today. The Lifespan Respite Act is a federal act that began 20 years ago in 2026, and New York State has been a continuous recipient of funding for the past 15 years. The core purpose of the Lifespan Respite Act award is to identify and coordinate existing respite resources, to identify gaps and create and monitor new respite services, to recruit, train, and pool paid and volunteer respite providers, to provide public awareness information, to connect families with respite payment resources, with respite providers and training, to promote consumer direction. And this act was established respite as a national priority, so much so that in the current climate, the Lifespan Respite Act was reauthorized in February with increased funding. I wanted to talk a little bit about advocacy and the work that we do, but I know that you all are no stranger to advocacy and the work that you do. But NYSCRC is a state partner with the National Alliance for Caregivers and is a member of the National Caregiver Network. The Caregiver Nation Network unites caregiving leaders across 10 states and a shared mission to improve support for family caregivers. This slide shows 3 of our staff and Jason Resendez, who is the president of the National Alliance for Caregivers, in front of Capitol in DC doing some advocating. The National Alliance for Caregiving fosters collaboration, provides essential tools, including policy and media training and data-driven insights from the Caregiving in the U.S. report. They cultivate and elevate state leaders so that we can champion the needs of caregivers in our states. Currently, NAC is advocating on the national level to broadly exempt family caregivers from burdensome Medicaid work requirements. And much of our collective work between NIAL and NYSCRC does overlap. We know that currently the proposed HR 6137, recognizing the role of direct support professionals, has been introduced and supports both of our missions. One powerful example of raising awareness about the challenges and rewards of family caregivers is something we offer called the caregiver simulation. This slide shows a picture of a large room filled with people in a big circle with a person in the center, and it's keying up a video. This picture is actually from the NIAL conference in 2019, where NYSCRC did host a caregiver simulation. And so if we can't do the polling polling in this, which is completely fine. We are just curious how many folks in this webinar have participated in the simulation before. So maybe just put in the chat if you have or have not, just to know what we're sharing here. A frequent reflection of people who participate in the caregiver simulation is how impactful it would be for those in positions of policy and decision-making to participate and have a better understanding of the needs, demands, and systemic roadblocks of family caregivers. We will be hosting a simulation either this year or next year, dates to be determined. And if you'd like to see the simulation come to your area this year, please let us know. There are actually plans in the work in partnership with the State Office for the Aging to offer the caregiver simulation at the next NIL conference, which is, as you all know, not in 2026, but 2027. I'm going to attempt the video, but please let me know if it's working or not, and if you can hear it or not. But my guess is we may have some hiccups.
So the caregiver simulation was developed after the poverty simulation by folks at James Madison University. It was picked up.
Put it in the chat if you can hear.
Sharon, it's Blaze. It was coming across fine, maybe slightly low.
Okay, thank you. And I see some buffering. So let's see.
Office for Aging, we are tasked with developing a comprehensive lifespan respite system in New York State. And we do that through education, advocacy, trainings, and the caregiver simulation, which is what I would like to talk to you about today. The goal of the simulation is to raise awareness and empathy for professionals who work with caregivers and for caregivers themselves. We most recently did it at the Arch National Respite Conference, and it was the largest simulation I think that anybody's ever taken on. We had 151 participants who were acting as either caregivers or care receivers, and another 52 people volunteering who were acting in the agency role. So the Department of Human Services, banks, grocery stores, the Veterans Administration, all are represented throughout the caregiver simulation. Each participant has a role. So they're either a caregiver or a care receiver. We have 7 simulations that are going on throughout the entire process. Each scenario and each caregiver and care receiver have some challenges that they have to face. So some are older adults, some are children who have experienced trauma, some are people with Parkinson's, some are people with MS. So we have a variety of different disabling conditions throughout the simulation. And each scenario or caregiver care receiver pair has 9 tasks that they have to get through the simulation. And that would include like paying their rent or their mortgage, getting groceries, getting respite, which is a very important thing for caregivers. And there's all sorts of different twists and turns throughout the simulation. So the idea is that people are experiencing the incredible amount of challenges that caregivers face. And then on the outside, where we have all the agencies represented, those folks are really learning what it's like to be in the shoes of caregivers, to deal with them as professionals, and showing them what the challenges are for caregivers so that we're not working in silos, that we're actually looking at the bigger picture of all the things that caregivers go through on a regular basis. We generally do 4 15-minute sessions, which are considered a day. And on top of the 9 things that they have to accomplish, they have one specific extra thing that they have to do. So they're constantly trying to get the next thing done without having time to really think about a plan, which is what caregivers often experience. They're juggling a million different balls in the air, and sometimes something gets thrown in, like the heater goes out, or somebody becomes incontinent, or somebody steals their Social Security check. All those things could happen and throw a wrench in their plan for the day. They have the challenges of having to use a wheelchair, a walker, a cane. We use earplugs to simulate hearing loss. We use tape on the hands to simulate arthritis. And we use funny little glasses with stickers all over them to simulate low vision or vision difficulties. So amongst all the other things that they're dealing with these healthcare issues as well. It's fascinating. It's different every time we do it. And one of the biggest pieces is we do a very important debrief at the end. So we have people gather into smaller groups and talk about what they experienced and what it was like to have those kind of caregiving pressures, what it was like to serve someone who was really stressed out, and maybe different ways that we could approach them. And in the end, people walk away feeling overwhelmed. They feel enlightened. I've heard over and over how they can't believe how much caregivers go through, and oh, they never thought about that. And we've been doing the one piece where we make them switch roles at the very end. So the caregiver becomes the care receiver, the care receiver becomes the caregiver, and we ask the care receiver, the original care receiver, to tell the caregiver one thing that they appreciate about them. And we give them a few minutes to think about that and to do it. And fascinatingly enough, our numbers completely turned around, so people started walking away feeling like there was joy in caregiving, and we don't want anyone ever to forget that there is joy in caregiving, and that people do feel good about what they're doing even though they feel challenged all the time. So that was a really important takeaway for me. So what I would like to share with you today is that this simulation is available to any organization in New York State. We would love to come into businesses and talk to business owners about being flexible with their caregivers and understanding how important it is to support them and give the time and space that they need to care for their loved ones. We would love to come into any human services agencies and really help and do it right in your community so that you can really begin to raise the level of awareness about what caregivers need. If you or anyone would be interested in bringing the caregiver simulation to your community, you can reach me, Doris Green, at 585-287.
Blaze here. Is the video buffering or what's?
Yeah, it's stopping. I apologize. I'm going to restart. It was just the 6-minute clip of the entire video. So you got through what we wanted you to see. So let me just jump back in. I apologize. I apologize. I'm getting right to my second screen. It's not
6393, or reach out to me through the New York State Caregiving and Respite website, which is NYSCRC.org. Thank you.
Okay. I will get this where we need it to be. There we are. And again, I apologize. So we talk about what respite is. We saw in that video that there were a number of objectives they had to complete in that day. One of those was certainly respite. And so when we talk about respite, one thing we know is that systemically across the state and across programs, services, and agencies, there are different definitions of what respite is. And so one of the poll questions that maybe think as we go through this for yourself, whether you yourself are also in that role of being an informal caregiver, care provider, if you have been in the recent past, and if you did, and if you are, do you have consistent respite support so that you can get a break from that role of family caregiving so that you're rejuvenated? Because we know that it's really very important.
I'm Jimmy. I'm the host. Thanks for watching. Thank you for joining forces with us tonight. We are coming to you from our home in Hollywood. We have a big show tonight with a man who might be the 48th president of the United States one of these days. Governor Gavin Newsom is here. Gavin, did you bring all your parking tickets to have them voided like I told you to?
I did. I already gave it to him in the green room.
You know, Gavin Newsom might be the only guy who wears more hair gel than you do. I don't know.
I don't know about that.
Anyway, Governor Newsom will be here shortly, and if you're watching in bed at the White House, you might want to stay up because we are definitely going to be talking about you, girl. Okay? President Donald Trump did find time between bombings yesterday
Hey,
to
Sharon.
post what the New York Post
Sharon.
called apocalyptic.
Excuse me. We've heard Jimmy Kimmel for the
Oh
past
my goodness.
30 seconds.
Oh my goodness. Okay. That's not what I intended to have. This will be a memorable webinar for you, I think, although it's going to be one I'm going to wish I hadn't participated in at that
No. You're A-okay.
Yeah.
Technology has a mind of its own. I was like, wait, I don't think this is quite jiving with what you had just said.
Actually we had that happen at a national conference one time too, and YouTube just kept going and going, and I think that's what happened.
Oh yeah, if you don't pause the video, it auto plays.
Yes.
So
Blaze, I really appreciate you letting me know before I went much further.
Yeah, sure thing. So you might want to restart from
I don't think that
right after the video, if you can.
Just make sure that I try to get way away from the videos if I can. I do see Wendy had a question. I don't know if that's something we need to.
I think we took care of it.
Oh, thank you, Wendy. See, now we know who's been watching too much. I apologize if there was any content that was inappropriate.
I think we all can universally agree that things are not good right now. I think we can just leave it at that and carry on.
Thank you for that, Blaze. Okay, so I assume you didn't hear the quotes, the percentages I was talking about. So
No.
Stop me if you did. But we know that 97% of family caregivers in New York care for an adult. 50% of those caregivers are caring for a parent. 13% care for a child with a complex medical need. 64% of caregivers are married or living with a partner. 1/4, 25%, 1 in 4 caregivers live in a household with an income under 50,000. Nearly 3 in 10 caregivers are a sandwich generation who care for both an adult and a child who's under 18. 1 in 10 live with a disability. 1/3 of family caregivers live with their care recipient, and 4 in 10, as it says here, would find respite helpful, but 8 in 10 have never used such services, and this is why we do our work. We know that people who are in the role of family caregivers rarely identify with that description. The State Office for the Aging has created a video, which, Blaze, I am not going to attempt. Hopefully I can bypass it. But please know all those video links will be in your materials that Blaze will send out after. But lots of people don't identify as a caregiver. There are many reasons for that. There are a number of cultural reasons for that. And sometimes it's because of the nature of the caregiving, someone with a mental health condition, people raising children who are not of their own, what we call kinship caregivers. It might be because of cancer or dementia or ALS or addiction. And so at the coalition, we do support family caregivers across the lifespan and across the age and disability spectrum. So not just, although our programs are flowing through the State Office for the Aging, we really do address the needs of family caregivers across the lifespan. Go. Get it.
Introduction.
Oh, I got it. I'm so excited. Oh, but on to another video. Note to self, please. Okay, so I wanted to talk about some of the programs that we do have. We have mini grants and respite volunteer sites across the state. We've been doing mini grant programs so that faith-based communities or college student groups or community centers can begin a small drop-in respite program. Typically, these are for people with memory impairments. We tend to gravitate to that. But you may be able to see on this slide that the teal dots in the map that's blue predominantly of New York State identify the places where we have started respites. We have quite a few sites who, after the year of mini grant funding, continue to share with us the terrific data they have and the success they continue to have in offering these programs. We also have, you'll see on this map, coverage across the state, and I'll talk about the voucher programs in a few minutes, which is the deep blue covering the entire county. And then the red dots are another program we have with AmeriCorps seniors. We also have webinar programs. We offer monthly webinar programs, much like that you do. So we have two coming up, one in March and one in April, on part of a series that we asked some experts to help us with. The first that coming up next week is future care planning for people with IDD. And in April, we'll have environmental modifications at home for people with IDD. So if you're interested in those, please visit our website to register for them. And we also place all of our recordings on our YouTube channel. So another really successful program we have is our respite voucher program. It helps family caregivers who find themselves ineligible or they may have an eligibility for public benefits to receive respite, but there may not be aids available, there may not be help available, they may be put on a waiting list. So this really addresses this need. So we began offering the vouchers in 2022, much like many other lifespan respite grantees across the country were successfully doing. And so after a thorough review, resulted in what is today this highly successful mechanism for often families to take that first step into respite and saying to themselves, I deserve a break, I need a break, perhaps I'm in crisis, but now is the time. So since beginning this program, caregivers collectively experienced over 20,000 hours of respite at an average cost of less than $18 an hour. So who qualifies and how does it work? Well, the voucher is $600. It's available to anyone over 18 caring for an individual with a chronic condition, and also kinship caregivers, anyone who is not currently receiving respite services through a publicly funded program. In addition, the selected respite provider simply cannot be someone who's living with them. The voucher program is considered a low barrier program with minimal hoops to jump through. And all of the application information is available on our website. It's available in both English and Spanish. You can download them. You can scan them to us as an application or mail them back. To increase efficiency, we are also working on developing an online application so that it can simply done all online. So once approved, a caregiver has the power to hire and train their own respite provider, which could be an agency or an individual contractor or even a family member or friend. And one of the most frequent questions from voucher recipients is, where can I find someone? I don't know anyone. I can't get help through an agency. And so one strategy NYSCRC has implemented is to assist through the Respite Registry. And I'm going to talk about that in a little bit. But it's an opportunity also for the NIL community to be a resource for family caregivers searching for help. So family caregivers can select their providers, that they negotiate the rate, they negotiate the time and the method of the respite. Some kinship caregivers, for example, have used their voucher for a summer program for the child or the children, providing a break for that caregiver when school's out and providing a healthy activity for the child or children. Once the caregiver identifies a provider, they can be paid directly through timesheets to Lifespan and NYSCRC, or we can pay the family caregiver as a reimbursement. We don't have to tell you that New York is and has been facing a significant home care workforce shortage due to low wages, challenging working conditions, high patient to worker ratios, and not to mention the larger climate. These issues contribute to difficulty for family caregivers to recruit, retain providers, and some estimates, as you well likely know, suggest the need to fill over 1 million positions. Efforts to address the shortage include legislative proposals, state funding initiatives for training, use of technology, and many people are on Medicaid, which, unless you have financial security, is really the only way, as you know, to access funding, the funded programs. So at NYSCRC, we've implemented the Respite Care Provider Training and Registry. This slide shows a picture of a young woman kneeling next to an older adult female in a wheelchair, both smiling. So we really ventured into this training program with 10 other states in 2022 as a pilot to launch a national respite care provider training. We have completed that pilot, and now this training is recognized as a national respite care provider training. And one of our efforts is to use this to really address the gray market in home care. You know, that gray market is an underground caregiver workforce. They're really generally unaffiliated with a home care agency. They're typically working independently, hired directly by that client or family. We know that nearly a third of Americans who arranged pay care sought gray market care for persons with dementia, and 65 combined that gray market care with unpaid care. Respondents who arranged gray market care had 66% lower odds of currently working, and those living in rural areas had almost 5 times higher odds of arranging dementia gray care. And so it really speaks to the necessity to provide family caregivers with a more robust opportunity with trained individuals who know and understand what respite really means. And so we are working to launch the respite care provider training across the state. It is now available. Again, you can find that on our website. It's self-paced. It is available in English now, coming soon on the website in Spanish, but really speaks to all the core competencies for providing respite as an individual or as an agency. It's interesting, I did, in preparing for this, went and searched whether and what are the differences between a respite care provider and a direct support professional. And so at the Regional Centers for Workforce Transformation, they said, when asked, is a respite worker considered a direct support professional, the answer was yes, which I find very interesting. we know that there is a lot of overlap in skills between a respite provider and a direct support professional. And a direct support professional can certainly provide respite, but a trained respite provider is not always or may necessarily be trained or skilled to do the work of a direct support professional. So doing another search, here's the key differences between a direct support professional and a respite provider. And really, it's part of it is the goals of the care, whether it's designed to be a long-term strategy or a short intermittent support for a break for the caregiver. But really, we know one of the main differences from our lens is that a person who's providing respite requires that the dynamic has a family caregiver who's getting the break. Direct support professional or the work that you do doesn't always necessarily include that family member who's doing the assistance. These are a comparison from CMS of the core competencies for both direct service workforce and respite care professional core competencies that were developed out of that pilot. You'll see that the top ones in blue, there's 2 columns of text that are side by side, and the top half of those columns are the competencies that overlap. Certainly not always in the same amount of training, but at least the competencies overlap. And the bottom 6 are the differences between the core competencies in those 2 areas. This slide lists 101 through 110, which are the courses on our online training that are aligned with the national core competencies. So what is respite, disability basics, client care, medication awareness, safety, caring for challenging moments, health, wellness, and respite activities, professional ethics and interpersonal skills, meeting the caregiver and care recipient, and then next steps for them. How can they take this training and move it into something bigger, broader, join an agency, become a DSP, become a CNA? What would they like to do next with this training? So the training, again, is free. It's online. It's self-paced. We are developing now an instructor-led training so that individuals can pick a date when we've scheduled the training, and they can be walked through it with some of our staff members. They will receive a certificate upon completion, and then they will, as individuals, be eligible to be listed on the Respite Registry. This image has looks like a young woman in scrubs surrounding an older woman who they're both smiling. Actually, as an aside, a couple of years ago, I did a Google search of family caregivers and sorted by image. And it seemed to make it seem so lovely and always so happy and so cheerful. And it was difficult to find a search engine to show, some of the realities in an image of family caregiving, because it can be challenging. So this graphic, calling all NYL members, here's a way for family caregivers to find you and your organization. So if you are interested in getting, as a provider, some clients under respite, which obviously may or may not be through Medicaid process, you can take the training, and at the completion of the training, list yourself on the Respite Registry. This is a screenshot of what the registry currently looks like. It's right on our website as well. So family caregivers agencies can go to this site and find respite providers. There's a section there that will lead them back to our voucher page if they do need assistance with paying for respite. We include a respite self-assessment and a caregiver self-assessment. I will say that we are modifying this registry in terms of those who can self-populate as a provider. So right now you're welcome to go on and create an account and as a provider, but know that we're going to be switching the process in the next week or two. So if you're interested in learning more about that, please just let me know, reach out, and we can stay in contact with you about when that relaunch is going to be taking place. So it's much like a care.com, except there's no fee. It's statewide. And so you can see some of these listings here are individuals and some are probably organizations that you're familiar with. This image shows just a lot of blank fields for search filters, and then a listing of providers in that area. So I just want to wrap it up so that there's time for any questions that you may have. If you have any questions about the simulations, the respite care provider training, or the registry, please reach out to me. If you have questions about the respite voucher and advocacy, please reach out to Rebecca Hyde, who's on our staff and handles both of those areas. But again, I applaud the work that you do. I stay up to date on social media with the advocacy that you're doing, which is critical, and hope that we can find ways to work together, support each other's initiatives as we move through these unprecedented times. So I'm going to end my slideshow here and see if there's any questions or answers or comments or suggestions.
Sure. This is Blaze. Sharon, thank you so much for the great and interesting presentation and some of the bonus content that we got for free as well.
I think it was worth the actual videos not working, right?
So actually we have we've got some questions coming in, and I'm going to ask our staff person here at NILE, Jose Hernandez, our advocacy and policy associate, to help me out with those, because I'm also handling some logistics for a press conference on the Consumer Directed Personal Assistance Program. So thanks for pinch hitting for me here, Jose.
Not a problem. One of the questions is, will you be able to email the flyers to participants?
I'm sorry, you cut out a little bit.
I'm sorry. Will you be able to email the flyers to participants?
The slides for this presentation, if that's what you mean, absolutely. They'll be coming out from Blaze.
Yeah, I think you were talking about this came in around 12 or so minutes ago, Sharon. But yeah, I'll be emailing the slides to everyone who registered, as well as the YouTube recording of this and a short survey. We were hoping to pull off a webinar poll during the webinar, but technology just was not our friend, and it's the first time we've ever done that here at NILE, and I messed it up. So
we will get it for next time.
Yes, indeed. So there'll be a short survey, the YouTube recording, and the slides. So back to you, Jose.
We have another question from Anonymous. Do you provide trainings in New York City?
Do we provide training to?
In New York City, for New York City?
Yes, we are statewide. We cover the entire state. And we are, just as background, we are a staff that started in 2010 of one person, a newsletter and a conference, and now we are a staff of 6. And our staff is largely remote, so we're in Rochester, Syracuse, Utica, Portland, and the North Country, not a physical presence in the city, but we do serve the entire state.
Awesome. And we have a comment from Joyce. It says, awesome presentation.
Jimmy and I thank you.
Jimmy. And we have one more, just for clarity. One must complete the NYSCRC training certification to be added to the Respite Registry.
That is correct. That is correct. And as I said, and part of the reason I wanted to share the side-by-side comparison of the core competencies of DSP and respite providers is because there's a large overlap. I can't imagine it will be a very difficult or different learning. You will know much of it, but really the focus on that training is the emphasis on the caregiver getting a break and making sure you're looking from the lens of that dynamic as you're going to provide respite. So it's a long answer, but yes, you must complete the training successfully before you can list as an individual on the registry.
We just got another question. Is the training in person or virtual?
So right now it is all online, so it's self-paced. You can go on and create an account. We are working and developing right now to create it as an instructor-led. So it's sort of a hybrid. People will log in and the leaders will walk participants, learners through the material so that they can get the certificate through that mechanism. We are open to other ways of presenting it. Certainly in person would be ideal. The logistics of that, we would need to explore. But if an organization was interested in bringing the training for a number of people, we could certainly talk about that.
And I think, oh, hold on. We got another question. Can you put a link for the training in the chat, or will it be sent to us along with the PDF?
Yep, and you can find it all on our website, but I'll put that in the chat as well. So that brings you to our main website, and you'll see on the top navigation bar of the website for respite providers. And that's where you'll find the training and the registry.
We have another question from Anonymous. What about the training for agencies? Are they in person?
They can. I mean, we haven't been approached by an agency to do this in person yet. We would certainly explore the possibility of doing that. We know that some agencies also have for staff in-service requirements, which this would probably lend itself well to. But certainly anybody who's looking for a delivery model different than what we have right now, which is online, let's certainly talk about it and see how we can help you.
From Vernon, if a deaf or hard of hearing consumer or patient needs ASL care personal aid, you can contact deaf or hard of hearing services in independent living centers. ILCs will help you seek the person who knows ASL. So it's more of a comment.
Absolutely. And thank you for that.
Any more questions?
And we're doing pretty good on time. We've got 10 minutes here for folks to ask any questions. So in the interest of just filling time, which when you go to broadcasting school, that's one of the things that you learn to do. We are going to have a really interesting webinar in April. We're still finalizing the date, but it is on the need to end sub-minimum wages for people with disabilities, because there is a section of the federal labor laws called 14C, which allows people with disabilities to get paid less than minimum wage. I believe 16 states have already done this, and we're desperately trying to get that done here in New York. It's frankly a discriminatory, antiquated practice that's been around since 1938, and we're going to be covering all things sub-minimum wage, to the work that's being done in New York, what other states did federally. We'll be hearing from people who have experienced working in sub-minimum wage workshop settings. This is an extremely nuanced issue because the reality is we have to do this. It's one of those things that you can't just flip the switch like a light and it goes away. We have to make sure that there's an employment sort of safety net. I don't really like using that phrase of safety net, but to make sure the people, and there are about 1,500 of them throughout the state who are in 14C certificate programs. So I just wanted to, and I know a lot of the folks here on this webinar in the aging space, but I really wanted to highlight this as an issue as we're waiting for more questions to come in on Sharon's presentation. So we'll everyone who registers for the webinar, we add you to our newsletter list. It's how we communicate our newsletters, webinar announcements. So you'll be getting info on that. So that's the little spiel there. Let's see. Oh, we have more questions coming in. I think.
No. I was just
Okay.
clearing up the Q&A.
Okay, I gotcha. So we'll give it another minute in case people have any questions.
But what a
So
great turnout today too, Blaze. Thank you.
absolutely. Well, thank you for there's I've been doing this work for 11 years, fresh out of college.
Hmm.
And it's always great to see the support that the aging services providers bring to the independent living and disability space. And always great to work and collaborate with you on these issues because like aging, disability, once you get it, is a lifelong process, whether
Right.
you're born with it or you acquire it. So it just makes all the sense in the world that we work together. So hearing that,
Absolutely.
yeah, so knowing there are not any more questions, so again, I'll email the recording, the slides, and the survey. It's probably going to come on Friday at this point, or early next week. So I'll send that out to everybody, and Sharon will be included on that email, so you can reach out to her directly with any questions that you have. So with that, you get a few minutes back of your day. How about that? And thank you so much for attending, and have a great rest of the day.
Thank you. Thank you, everyone.